Subcommittee on Health will now come to order. Chair recognizes himself for 5 minutes for an opening statement. But first, as auspicious as we gather today, it is a day that is so steeped in history. Last night was the California primary election. We all remember 50 years ago after the California election is when the country lost Senator Robert Kennedy. This is also the 74th anniversary of the landing at Normandy and D-Day. This is the 100-year anniversary of the Battle of Belleau Woods, when the Marines basically initiated World War I for the United States of America. And it is 100 years since the Spanish flu ravaged not just our country, but the world. So it's appropriate that we convene today to authorize the Pandemic All Hazardous Preparedness Act. Again, a century ago, our country's in the worst pandemic in its history, claiming the lives of almost 700,000 Americans and killing more than 50 million people worldwide. We will listen to testimony and we'll discuss this critical legislation. It is paramount that we remember the significance of this centennial anniversary. Sporadic flu activity has been spreading through the United States, Europe, and Asia. In the months following, the country and our soldiers faced an illness that we were not prepared to handle. In that October of 100 years ago, more than 100,000 Americans died as a result of the Spanish flu. It goes without saying that we have indeed come a long way. A century later, we are substantially more prepared. As we consider this legislation, we must remember that there is more to be done to support America's public health security. The creation of the Assistant Secretary of Preparedness and Response under the original legislation in 2006 has helped us to make monumental strides in preparedness, coordination, and response. Close collaboration and efforts between the Centers for Disease Control, the Food and Drug Administration, our local, state, and tribal and territorial health partners has been vital in making progress in this regard. Much like politics, public health is local, and it is executed on the ground by our hospitals, by our health departments, and our emergency responders, who are our front lines addressing infectious diseases, disasters, and threats. I do want to thank my fellow Texan on our second panel, Dr. Umar Shah, for being here today and to share his testimony and for his leadership in protecting the health of Harris County, Texas. Recently, Dr. Shah and his team responded on the front lines for Hurricane Harvey, which caused such catastrophic damage in the Houston metropolitan area and did require a large coordinated response from all of the organizations that we have before us today. We'll hear more about critical issues that must be addressed to continue and strengthen the nation's preparedness and response capabilities. We will talk about proposals to strengthen the strategic national stockpile, our cache of life-saving medications and supplies for public health emergencies. We also must address the policies that affect our regional disaster response system. It is essential that the program continues to integrate and coordinate at the local level. Additionally, we must provide assurances to protect those who respond to our health emergencies. We will also discuss sustaining the robust and reliable security capabilities, such as disease surveillance, containment, risk, and countermeasure distribution. We must evaluate the domestic biologic surveillance systems, such as BioWatch, taking a closer look at what can be done to bring these programs up to date so that they're operating with the most efficient technologies and capabilities. Finally, we must look for innovative ways to continue to advance medical countermeasures, ensuring that Americans can access medications that will provide critical protection in the future. As we consider the problem of antimicrobial resistance in this country, we must address new methods to curb this growing problem. Frontline facilities and responders in Dallas, Texas experienced this firsthand in 2014 when a patient presented with Ebola in a DFW emergency department. We must remember that infectious diseases are a mere plane ride away, and we must continue to ensure that we are prepared and ready to respond. This Pandemic All Hazards Preparedness Reauthorization is critical in protecting the lives of all Americans and providing the necessary tools and infrastructure to ensure that they're in place when disaster strikes. I want to thank both Representatives Susan Brooks and Anna Eshoo for working on this draft legislation. which is being considered today. And lastly, I want to thank all of our witnesses for testifying before us this morning. I do look forward to a productive discussion on a broad array of issues that will be the focus of this authorization. And I will yield the balance of my time to the gentlelady from Tennessee, who I believe is celebrating a birthday on this day rich in history.